ALS is a terminal and progressive neuromuscular disease. Over time it kills off the motor neurons, which communicate from the brain to the muscles. This results in total loss of independence for the individual diagnosed, and it takes away breathing, speaking, walking, chewing foods, using your hands for anything. And the order of those symptoms vary from person to person, but over time, those are some of the general symptoms somebody has. So the primary caregiver is certainly impacted the most within the social support by the disease. Primary caregivers are often the ones that are transferring patients in and out of bed or in and out of chairs. They are doing all the personal hygiene tasks. They're feeding patients. So they have that physical burden that comes along with the diagnosis. Oftentimes we'll have caregivers who are a lot smaller than the patient, so it can become, a really strenuous duty to provide care for a loved one. There's also the mental stress too. Caregiving is a 24-hour job. There are very few breaks, especially if the social support is very small. So that becomes very emotionally tolling on an individual to be caring for somebody around the clock.
My name is Ann Kramer. My husband was Gregory Kramer. Gregory was diagnosed in October of 2014 with ALS. In taking care of a patient with ALS, being a caregiver is very difficult because it's your husband. And in doing all the things for him that he couldn't do anymore, he was losing a sense of his self. And as a caregiver, you're there doing everything. You're preparing the meals. You may have to feed your loved one, dress them, bathe them, toilet them. I worked as much as I could. We were lucky. He had friends, he had family, and we were blessed with the Respite Care grant from the ALS Association, so caregivers came to our house several days a week to help take care of him. As a caregiver, to sustain myself, I needed a break. To take care of a patient with ALS is all-consuming.
So some of the best interventions for caregivers to remain emotionally and physically intact are self-care. So whether that be, going out to lunch with friends, or getting away for a weekend fishing trip, or even going to their own doctor's appointments to manage their own healthcare needs, all of those things are really important to take care of and manage as they're taking care of their loved one. If they can't take care of themselves adequately, they're going to be useless to the patient over time.
So on a day-to-day basis, I still work full-time out of the home. So normal day for us is we wake up, I get Steve dressed, I get him ready for the day. I bring him outside, put him in either his wheelchair or on the couch. He gets his medications, and then I usually leave for the day. And then another caregiver, his dad, usually comes to the house and gets him his meals and the rest of his medication, and just takes care of him throughout the day, whether that's, hygiene, bathroom trips, whatever it is. And then I'll come back in the evening, and in the evening we do another meal, and then hygiene and just the day-to-day tasks. So I work outside the home, and I think that's part of the reason that I'm able to do what I do with Steve, because for 40 hours a week I'm not a caregiver. I'm doing my normal job before ALS was a part of my life. And so I think that's it's not necessarily a break, because we have our own challenges at work, but it's a break from taking care of someone. And it's a chunk of my day where I'm not focused on Steve. I'm focused on other things, and then I come back and I'm able to do a good job. The most rewarding thing is when I see him engage in something that he's passionate about, and he's able to help other people, because he's supported, and he's in a healthy environment. And from that, he's able to go out and advocate or help other people that he thinks are neglected. And it's really encouraging to see him engage in those activities and know that that's because the reason he's able to do that is because he's in a healthy environment at home.
On average, the cost to a family annually is around $250,000. I mean, it's unbelievably expensive, and insurance plays a very small role in that. It can, it depends on the individual again, but it's a very small role. A lot of this is dependent upon the families themselves to come up with this, and that's why the spouse or an immediate family member usually has to stop their job. They have to resign from their job and become a full-time, 24 hours a day, 7 days a week, 365 days a year caregiver for their loved one. And that's why this program is so vitally important moving forward, so we can help these families out. And we've always provided a relief program, or a respite program as it were. We'd like to take that to the next level, because this is the overwhelming need. In all the surveys that we do, whenever we talk to patients, whenever we have an opportunity to speak with anyone who's at all related or a friend of a patient, the thing we always hear is, boy, we could use some more respite time, or we could use some more relief time. Yeah. And it only makes sense. That's the big contributing factor that causes so much of the stress in the household, is that there's just a lot of times these families feel there's no one here to help me, and we can help them to a point, but with the relief program, that would certainly go a long way to helping them during this journey.
Yeah. So the ALS Association's caregiver program, it has two parts. There is a medical side of care where we will provide a monetary grant to a home health care agency to provide some support for the family. The agency may do things like, personal hygiene tasks, feeding, manage event care, those sorts of things. And then we have a non-medical side of respite, where that places a volunteer in the home who can do those non-medical type tasks like yard work, painting fences, running errands, things of that nature. So again, this goes back to anything that we can take off of that caregiver's load to better support them. We always try to do so, whether it be in the medical respite form or the non-medical respite form. This gives the caregiver a break in some form, whether it's to go out, and go to the coffee shop by themselves for a half an hour or however long they choose, or go take care of personal errands that they wouldn't be able to otherwise without this kind of support. So anything the chapter can do to provide additional services for families, we certainly do, because we want to promote self-care for the caregivers so that they can provide quality care for their loved one during a very vulnerable time of their life.
The Respite Care Program is a huge help for caregivers. I was able to have someone in my home to help take care of him so I could work and keep up our health insurance. To have someone come in and help. They did laundry, they helped give him a bath, doing things that I normally did, but I wouldn't have to do, so I had more quality time to spend with him. These are important things, and this is why the Respite Care Program is so huge, and why the ALS Association needs more contributions so that more patients and families get this help. You have no idea what it means to have the freedom just to go to the grocery store or to go get your hair done and get away for just a few hours, because you feel guilty leaving the house. You feel guilty leaving your loved one. You can't leave them alone because they could have a respiratory crisis and you wouldn't be there to take care of them. You need someone there.